Hello. Today we're going to talk about energy and nutrient-dense formula, ENDF. One product is Fortini supplementation in non-organic growth faltering. My name is Micah Resnick, and I'm a board-certified general pediatrician in Cincinnati, and I have great experience using an ENDF, Fortini in particular, in cases of non-organic growth faltering. So I want to take you through the presentation today to talk about how I've used it in practice and some concerns that you might have and hesitations about using this formula, and then plans for how to make it a part of your standard practice. So typically with children with non-organic failure to thrive, after you've ruled out any organic pathology, cardiac disease, renal issues, some other metabolic issues, we're usually left with a baby who needs some more calories. Conventionally, what we've had to do in the past would be to either, if they're breastfeeding or even using standard formula, increase the volume and give them more feedings more often. Another option historically has been to either concentrate the standard formula they're using or concentrate the breast milk with added formula to provide higher calories to the child. Another option in your practice you might have had experience with is using a higher calorie formula, something that's like a 22 or 24 kilocalorie formula, and some of us might have experience using a product, for example, or Neosure or other of the major preemie formulas. It's classically how we see them in general practice, children coming home from the NICU on these higher calorie formulas. And the final practice, which I haven't used that much, but you may have experience with, is starting with a standard base formula and adding other modulars to it, such as fats, carbohydrates, proteins. You may be familiar with the fats in the form of medium chain triglycerides, MCT oil, or human milk fortifier, other carbohydrates and proteins. And during this process, these approaches, we may face difficulties with our patients, which include tolerance, inadequacy of protein or carbohydrate balance, delayed feeding, mixing errors, and obviously parental stress. And it could also contribute to, stopping successful breastfeeding or interrupting it. As I mentioned, one common error or trouble we see is delays in advancing the baby to higher calorie formula, which can slow the weight gain, and that can be frustrating. Often during these times, too, there's a lot of trial and error that can cause frustration because we're trying new recipes or new formula types, or we start at 22 kcals and then we say go to 24 and 26, and that can just lead to a lot of frustration, both with the provider, the clinician, as well as the family. Also, with this practice of fortifying breast milk or formula or adding in modulars, sometimes without good expertise or guidance or support, we can be providing formulas or replacement feedings that are really unbalanced in their nutrient ratios, and so might not be providing appropriate protein or appropriate fats, which are critical to bone growth, muscle growth, and brain development. And finally, simply mixing errors can occur. If we're giving parents a new strategy, a new guide, and we don't clearly write down the formula or the process, or even if we do, sometimes errors still happen, and that can be detrimental both to the parent and to the baby. So I really want to talk to you today about an energy and nutrient-dense formula called Fortini that I've used in clinical practice in cases of children with non-organic growth faltering, and have had tremendous success. Just in this simple chart comparing concentrated standard formula at 24 kilocalories per ounce formula, as well as the practice of adding modulars to formula, we can see that an ENDF like Fortini provides tremendous calories, which can really boost growth, has the appropriate amount of protein per WHO and nutrition guidelines. Often these are well tolerated, and the osmolality is something that children with healthy babies, even with healthy functional kidneys, can tolerate. For full-term infants with failure to thrive or non-organic growth faltering, this is nutritionally complete product that they need everything they can get right in this one product. No mixing errors will occur because it's a sterile prepared liquid, so they don't have to add powders. You don't have to add other modulars that can cause stress in terms of appropriate ratios or appropriate access to the necessary products. So it's really very easy to use. And with more time, there continues to be a very robust literature that shows this is successful use in catch-up growth. And we'll talk about a case study later on today in the presentation, but have had tremendous success with good catch-up growth. So simply put, it's a well-tolerated formula. We can see a quick response in our patients, and we don't have to, frequently bring them back to the office. And in our experience, we are being able to preserve breastfeeding because we're not completely abandoning it. Often the child will only need 1 or 2 daily supplementations instead of constant fortification of breast milk or total, replacement with formula. So it's really great for those parents who want to continue breastfeeding that we can help them achieve that very important goal. These were some of my concerns when I was first presented with Fortini and the opportunity to supplement and use it in our office. I was nervous because of the higher concentration of calories. How would that affect my child's, my infant and my patient's bowel movements and their GI development? And I've had no trouble with tolerance. It's really, you can just go right to the 30 kcals. There are some studies that show that for kids under 12 weeks, we might want to do more of a graded introduction. So maybe starting with a 24 and then a 27 kilocalorie and then going to the 30 just for improved tolerance. But if you're starting this in kids who are over 12 weeks, you can go straight to 30 kilocalories and they tolerate it very well with minimal disruption to their GI system, symptoms of dyschezia or constipation. So that's really wonderful. The other concern that I had in my training, I really only would send kids home from the NICU in 22 or 24 kilocalorie preparations, and even in my daily practice seeing that. But I've noticed in the last couple of years, more and more of the babies graduating from the NICU are coming into my office already on higher concentrations. And if you've done a workup and you've ruled out any organic pathology, you should be reassured that your child, your infant, your patient has normal functioning kidneys and can handle this this renal solute load, which is not too high for them, and it won't kind of lead to dehydration, which can often be a significant concern. Fortini does not dilute protein, so we're making sure they're getting the adequate and appropriate amount of protein and fat in a well-balanced diet. So that's really, really key and important. The concern for overfeeding. So sometimes we have to frequently monitor because we don't communicate well with our patients to stop the practice of fortifying your milk, or don't overuse the formula we provided you, and can lead to overfeeding, reflux, discomfort, and also just too fast jumping of growth percentiles. But with Fortini, my experience has been it's a very brief use, and we don't have to worry about overfeeding as much because we're quickly, it's easy to wean them off, and we can quickly achieve our goals of catch-up growth. And finally, a stress has always been with children who are having trouble growing has been the increased monitoring requires, having to bring them back into the office weekly or every 2 weeks or every month, which can be really challenging for new parents, especially during sick season or cold and flu season. So with Fortini, generally my experience has been only needing to use it for a month or two, bring them in for a couple weight checks, and then quickly weaning them off after a successful growth return, catch-up growth and adequate supportive growth. So overall, our office and myself and my colleague, Dr. Rinderknecht, have been very happy with the supplementation we've used to help babies catch up in their growth. And now she'll tell you a little bit more about a particular case study in our practice and the ease and success with which we use Fortini. Thank you very much.